Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD, New York's only Harvard-trained, triple-board certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WOR studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hi, good morning. It's Gil Lederman, Dr. Gil Lederman from Radiosurgery New York. We're a cancer treatment center, and we're here for our new program, our 6 o'clock a.m. program. Thanks, Therese Crowley, for the news. Wow, there's a lot of death in the news. Death in Ukraine, and death in New York, and death in Gaza. But here we're talking about living and how to avoid death and how to live. And it's such a difference. So let's see if we can help you and your loved ones live, not die. And why do I talk about it? Well, number one, Therese's news. Number two, our first case to talk about, got a call from a man with a son who has BRCA-positive prostate cancer. Now, you remember the BRCA gene is responsible for women having bilateral breast cancer and ovarian cancer, and Angelina Jolie last year, who had her bilateral prophylactic mastectomies because her mother died of breast cancer when she was a pretty young woman in her 40s. And we see many women affected by BRCA genes. But here's a man affected by the BRCA gene, so it does affect men. It's not as common as women, but this gentleman had BRCA-positive prostate cancer. He presented with a Gleason 10. He chose, so he's already had his treatment, he chose to have robotic surgery. I guess he was told about all the bells and whistles, and he bought into it without looking at the data. So what is the data for open surgery and robotic surgery for Gleason 10? Well, you can look at our booklet, and if you go to the most famous surgeon in America for Gleason 10, the 5-year cancer-free survival is only 41%, at 10 years, 23%. So did this man know, a 40-year-old man, that he was choosing a treatment with a 23% success rate? Wow. Now, if you knew, if you came to us, and you had, and you can look at our data is on page, get to in a minute, page 11 of our booklet, which we'll send to you at no charge. With us, 70%, about 2.5 times better chance of being cancer-free for Gleason 8, 9, 10 prostate cancer than if you went and saw the most famous surgeon in America. Which would you choose if you had a Gleason 8, 9, 10 prostate cancer? Surgery with a 30% success, or us, non-invasive treatment with a 70% success, 2.5 times better? And if you look at quality of life, what percent of men have no sexual problem after surgery? This is a study from Harvard, and it's on page 14 of our booklet. Well, with open surgery, only 2.9% of men reported no sexual problem after surgery. With robotic, only 2.3% had no sexual problem after robotic surgery, meaning 97% of men had sexual problems. That means erections inadequate for intercourse, for penetration. 97% of men had problems with both open surgery and robotic surgery. And urinary problems after surgery, well, open surgery, only 19% of men had no problems after surgery with urine. Only 13% had no problems with robotic. So robotic is actually less good. And overall, that meant that 80 to 86% of men with surgery had urinary problems. Compared to us, 99% of men have normal urine. So would you like to have normal urine and a 70% chance of being cancer-free, or 30% with surgery? It's pretty clear the difference. Sad to say, this man probably chose robotic surgery because he thought it was the latest, greatest thing. Didn't have the data, I suspect, like most of the patients who go to surgery. We had one patient who went to a famous surgeon. He asked for the data, and the surgeon said, "Oh, my data is smoking." Well, maybe it's smoking, maybe it's smoking dope, but he should be able to present the data to the patient. And what a difference it makes. When patients come to us, they have a booklet, they can actually see the procedures, and they see comparison data to famous cancer hospitals, to famous hospitals here in Boston and Philadelphia and Baltimore and California and Texas and Chicago. You see the data, and data that you can understand. So if you have a prostate cancer, like this, a son with prostate cancer or a friend, you should look at the data, and you'll see why so many men come to us, because number one, of our results. Number two, we show you the results in a way that you can understand it. You're welcome to get the booklet. To get the booklet or DVD, just call us during business hours, Monday through Friday, 9 to 5, and we will send it out to you at no charge. It may save your life. We're talking about Al Sharpton shouting and screaming about saving lives. Well, here we can save many lives by doing the right thing and saving quality of life. Most men that we see want to avoid radical surgery. They want to have a higher success rate. They want to keep their urinary life and keep their sexual life. These are normal human desires, and that's what we fight for at Radiosurgery New York. This is Dr. Lederman, and we're taking your calls. By the way, we're live. We're live at the WOR studio. We're at 1-800-321-0710. If you have questions, comments, if you want the booklet, call us, our office number during the week. But this program, we're live, 1-800-321-0710. We're happy to hear from you. And our good news department. So we have a lot of good news today. We had a man, a Hispanic man, who's about 50 years old. He came with gastric cancer and liver metastasis. Okay, so it's stage 4 cancer. And yes, you'd think his goose is cooked. But the fact is, we treated him a year and a half ago to the stomach and to the liver. And guess what? He's in complete remission. No cancer. He just was staged up last month. He is cancer-free. He's had no treatment in the last year. Doing well, fully functional. We're going to, of course, send him for the most accurate staging of PET scan and cancer markers. But the last was done in June, and he is A-OK, fully functional, gained back his weight, having no pain, eating normally. That's the good news department at Radiosurgery New York. And more good news department. We have a gentleman with a leukemia that transformed to a lymphoma. He presented with a mass in his neck. All cancer, all lymphoma. The mass is about the size of 2 fists. So if you can imagine a person with a mass the size of 2 fists on the left side of his neck, from the mandible all the way down to the collarbone, massive mass, all lymphoma. He had one treatment 2 weeks ago. He came in this week for treatment, and the mass is 90% gone after just one of the 5 treatments. I know a lot of people get 6 weeks of daily radiation, or 20 treatments, or 30 treatments, or 40 treatments. No. 5 treatments with radiosurgery. Excuse me. Radiosurgery is focused on the cancer. He had 1 treatment, and the cancer shrank by 90%. Incredible. He is so happy. He is so happy. He walked in with a smile. When all the staff saw him, said, wow. He walked out with more of a smile. He had had so much mass in his neck. He had a chicken, and the chicken bone got stuck in his throat. He had to go to the hospital before we treated him. Now he's eating fine. The mass is shrunken. He's happy. We're happy. He's got 3 more treatments. We do it once a week. He's had no side effects. Doing well. We'll report back to you on how he's doing. But so far, A-OK. Happy patient. In remission. Doing great. And another good news department, a little bit funny. This is a woman, Indian American origin, Indian subcontinent, like Curry Hill, Indian. She had esophageal cancer. She went to a big famous cancer hospital nearby. She had chemo and radiation, surgery. She had 6 weeks of radiation and chemo, and she came back with recurrence of her cancer. And of course, when cancer came back, she gave up on that other hospital and came to us. And she shopped around. She went to other doctors, which is great. Everyone should shop around and get second opinions. And she decided to go with us. So we gave her, she had a big mass by the esophagus, right where the surgeon cut, exactly where the surgeon cut. That's where the cancer came back. It makes you think that the surgeon spread the cancer when he operated. And she had a second mass where he cut open her chest. So 1 mass by the esophagus where he removed the esophagus and the cancer came rip-roaring back. And 1 where he opened up the chest. 2 masses. We treated her with radiosurgery, 5 treatments. Radiosurgery is not surgery. It's no cutting, no bleeding. It's named radiosurgery because it uses the pinpoint radiation beam like a knife, but there's no cutting, no bleeding, no hospital stay, no anesthesia. Patient comes in, gets a treatment. Treatments take about 15 minutes, gets up and goes to lunch or goes to work. Anyway, she had her treatments. She came back for the follow-up. She had a PET scan, and everything's gone. Now, she still shops around to go to different doctors, and she went to this chemo doctor near her home. She lives north of Manhattan, and the chemo doctor never saw a patient in remission after treatment for esophageal cancer, and the chemo doctor wanted to send the patient for a second opinion what to do. And I thought it was a little bit funny that the doctor didn't know what to do when a patient had a complete remission. I thought maybe the doctor didn't have enough experience with good results. Whereas with us, we just talked about the man with stomach cancer and liver mets in remission. This is a woman who had recurrence of her esophageal cancer with a mass by the esophagus, causing her to be unable to breathe normally and unable to speak normally, and a second mass by the pleura, where the doctor cut, both in remission. And the chemo doctor that she was seeing was so bamboozled, wanted to send her for a second opinion about what to do when you're in remission. Well, I know what to do when you're in remission, and I bet you know what to do when you're in remission. You celebrate. And I hope this woman celebrates the beauty of our treatment, 5 treatments. She's in remission. She'll be back in 3 months for follow-up. What was my recommendation? Enjoy your life. Come back for follow-up. She's doing great. She has no pain. The pain went away. The breathing problem went away. The speaking problem went away. And best of all, the cancer went away where we treated her. So it's good news department. Thank God. And we're going to hear from a couple new voices at Radiosurgery New York talking about our cancer treatment. We're a cancer treatment center that's a private cancer treatment center located at 38th and Broadway. 1384 Broadway, near Macy's in Times Square on Broadway. What does private cancer center mean? It means that we work for you. We don't take money from the drug companies. We don't take money from the surgeons. No, everything is between you and us. There's no students. There's no practice. There's no guinea pig stuff. We give you the best possible treatment that we can give between you and the triple board certified doctor